Every multi-casualty incident is a race against time. When many people are injured, how we respond can make the difference between how many victims survive and how many die.
START, the simple triage and rapid treatment system, enables rescuers to do the most good for the greatest number of victims in the shortest amount of time. START training will help you save lives.
Triage is a system for sorting victims so the most seriously injured can be treated and transported first. Most rescue plans call for triage in a multi-casualty incident, but they don't tell you how to do it. We will. In this video, we'll help you learn START, simple triage and rapid treatment. Your START training will enable you to take charge when you're faced with many casualties and time is critical.
START training will teach you how to do 3 important things. What to do when you first arrive at a multi-casualty incident, how to assess an injured victim in less than a minute so that you can prioritize victims into one of 4 treatment categories.
In this video, we'll use a triage tag with 4 categories: minor, delayed, immediate, and deceased. Each category is a different color. The colored strips are removed, so the last color remaining on the tag shows the patient's classification. Triage identification may be different in your region, and you should familiarize yourself with the method used in your community. Any professional or non-professional with first aid training can learn and use the START methods.
Get ready. Get set. Let's start.
Newport Engine 5, Newport Medic 3. Respond to a traffic collision with injuries. Grid 39, Avocado and Coast Highway.
It sounds like a routine call, but are you prepared to respond to something like this?
Central Net, Newport Engine 5 at scene. 2-vehicle traffic collision, auto versus a transit bus. Stand by for additional resources. Norm, handle fire control. Pull a pre-connect.
Safety measures are your first priority.
Alan, I want you to make access to the bus and start patient triage.
We got 2 people in the car. We got about 20 to 30 in the bus.
Okay. Central Net, Newport Engine 5. Assign 3 medical task forces and 1 truck company.
The company officer calls for additional resources and will continue to evaluate the scene. The START method is the answer to the first responder's question: what do I do now?
Okay, help's here. Need you to back away from the glass as much as you can. Cover your faces. Cover your face. I need everybody to stand up and walk. Everybody stand up and walk outside here. Walk outside. Over to the curb. Walk over to the curb. How are you two doing? You look okay. I need you guys to stick around to help me, so just wait right here, okay? Are you able to walk at all? Get up and walk. Can you help him get up, but stay right there? I'm coming. Okay, I'm going to need one of your help. I repositioned his airway. I need you just to make sure his head stays in that position, okay? He's breathing on his own now. Just maintain that airway. Great. Okay, I'm going to need your help over here. Okay, she's bleeding pretty bad. I need you to hold pressure on that leg over there. Just put as much pressure as you can. I need you to stop the bleeding. You know your name? What happened? You know your name? Do you know what happened? What happened?
Somebody.
Get me out of here, please.
What's your name?
Jan.
Jan, do you know what happened, Jan?
The bus went over, I don't know.
Okay. You just stay right here. We got additional help coming, okay?
Please get us off here, please.
This firefighter has just triaged 15 injured people in less than 3 minutes. 9 people were categorized as minor injuries because they were able to walk away without help. It took less than 30 seconds each to assess, categorize, and tag the other 6. With START, you can confidently triage patients so the most seriously injured can be treated and transported first. Now let's return to the bus accident and learn how to use the START techniques.
I need everybody who can stand up and walk to do so. You just stand up and walk outside here over to the curb.
It is important to clear the scene of as many minor injuries as you can. Direct victims who can walk to a specific destination nearby and tell them to stay there. By asking the walking wounded to leave, the rescuer has just triaged 9 victims into the minor injury category in a matter of seconds.
How are you two doing? You look okay. I need you guys to stick around to help me, so just wait right here, okay?
Non-injured bystanders can be used as a resource to help provide basic first aid to those who are injured. This is part of the rapid treatment that takes place during initial triage. What victim gets your attention first? The unconscious child? The man covered in blood? The hysterical bus driver? Because you have no way of knowing at a glance who and where the most critically injured victims are, you start where you stand. Patient assessment begins as soon as the walking wounded have been directed away from the scene. The START assessment is simple and easy to learn. It only has 3 steps. RPM. Respiration, perfusion, mental status. RPM. When you're facing a multi-casualty incident and you're all revved up, just remember RPM. Now we'll learn how to use RPM to assess each patient in about 30 seconds. Respiration is the first assessment because it is the most critical function. If the patient is not breathing because of an obstructed airway, attempt to clear the airway. Depending on the type of obstruction, either reposition the patient's head or remove any debris that may be lodged in the throat. While repositioning an injured patient's head may be contrary to what you've learned about cervical stabilization, Dr. Greg Super explains how to handle a patient who's unconscious and not breathing.
If we do nothing, he's a certain field death. If we open his airway, we may aggravate an existing cervical spine fracture. We chose to make that intervention. If we open his airway, he makes attempts to breathe, and we can keep that airway open, he may have a chance to survive. If we leave the airway closed, he has no chance.
If respiration cannot be reestablished with these simple measures, don't waste time attempting CPR.
The first rescuer's basic instinct might be to begin CPR on the first one he encounters. That would be a mistake. These people die. If the first rescuer goes to CPR on the first victim he finds in full arrest, he will not be available to help those who still have a chance at living.
Non-breathing patients are considered non-salvageable and are categorized deceased. Move to the next patient.
Okay, need help over here. Need your help support his head. Okay, just like this. Need you to help keep his airway open. Just like that, okay? Great. Don't let the airway close.
If the patient begins breathing after the airway has been cleared, categorize immediate and move to the next patient.
Rolling.
To assess respiration on a patient who is breathing, observe the frequency of respirations. Patients who are breathing at a rate of more than 30 respirations per minute are categorized immediate and no further assessment is done. Move on to the next patient. Although you won't take time to actually count respirations, you can become skilled in visual assessment by watching others simulate rapid breathing. With practice, you will be able to easily differentiate between a person who is breathing faster than 30 respirations per minute and one who is breathing at a normal rate. If a patient is breathing slower than 30 respirations per minute, proceed to the next assessment, perfusion. Here's how the respiration assessment looks on the START flowchart. If the patient is not breathing, reposition the airway. If breathing does not resume, the patient is non-salvageable and is categorized deceased. If breathing resumes after you clear the airway, categorize the patient immediate. Patients who are breathing at a rate of more than 30 respirations per minute are categorized immediate and no further assessment is done. If the patient's respiration is slower than 30 respirations per minute, proceed to the second assessment, perfusion. In a multi-casualty setting, the capillary refill test is the fastest and most effective way to check perfusion or circulation. To do this, press down on the patient's nail bed and release the pressure. The skin underneath the nail should return to normal color within 2 seconds if perfusion is adequate. If it takes longer than 2 seconds, categorize immediate and move to the next patient. The radial pulse can also indicate perfusion status. If you cannot feel a pulse, the systolic blood pressure has probably fallen below 80. The patient's legs should be elevated to improve blood flow to the heart, lungs, and brain, and the patient categorized immediate.
Put as much pressure you can on there. I need you to stop her bleeding, okay?
In situations where a patient has severe external bleeding, direct the patient or a bystander to apply pressure to the wound. If the patient has adequate perfusion, proceed to the third assessment to check mental status. On the START flowchart, the perfusion assessment looks like this. Check capillary refill by pressing down on the patient's nail bed. If color does not return within 2 seconds, categorize the patient immediate. Elevate the legs and control bleeding if necessary. If the patient has adequate perfusion, the nail bed capillaries will refill within 2 seconds and you will proceed to the third and final assessment, mental status.
What's your name?
Brain injury accounts for half of the deaths in disasters. Patients with altered mental status are categorized immediate. You may have already observed the patient's mental status during the first 2 assessments. If the patient is unable to respond to simple questions or commands, categorize immediate.
My leg over here, my leg. Oh God, I think it's broken.
Just relax, just relax. Okay, you're breathing fine, you're breathing fine.
Get me out of here. Please, my leg really hurts. It really hurts.
Okay, you've got a good pulse. You've got a good, strong pulse. What's your name?
Jan.
Okay, Jan. What day is it?
Friday.
Friday. Good. Okay.
Please, it hurts. Oh God.
More firemen are coming. Okay, we'll get you out of here as soon as possible.
Hurry.
All right, I've got help coming.
If the patient can follow simple commands, categorize delayed and move to the next patient. Here's the mental status assessment on the START flowchart. If the patient fails to respond to simple questions or commands, categorize immediate. If the patient can follow commands, categorize delayed and move to the next patient. The delayed category does not mean the patient is not injured and does not need treatment. It means the patient isn't at high risk of early death. As you have seen, every patient is triaged and categorized depending on the need for medical attention at the time of assessment. Immediate patients need to leave the scene as soon as transportation arrives. For patients awaiting transport, a second, more thorough field assessment will be done by qualified personnel. They will update the patient's condition and provide further treatment. You have just seen how quickly and efficiently you can use START triage to rapidly categorize and treat patients. When you're one of the first rescuers at a multi-casualty incident, your START training ensures your efforts do the most good for the most people. In this video, you have learned how to Direct the walking wounded away from the scene to reduce the number of patients you need to assess. How to use bystanders for rapid treatment of severely injured patients. How to start where you stand to begin patient assessment. How to use RPM to rapidly assess a patient's respiration, perfusion, and mental status. And how to use a triage tag as a method of categorizing patients.
The START plan is the answer to the first responder's question, what do I do now? He has two critical things to accomplish. The first is to find those victims most likely to die at the scene, and the second is to bring medical organization to the scene.
START is a time-saving, life-saving way to prioritize and help patients who are in the greatest danger of dying. When every second counts, the START system wins the race against time.
As a new firefighter, I found the START system to be an easy and simple to follow tool when doing patient assessment. Once on scene, we can go ahead and have all minor patients moved to a safe area, then use RPM to assess the remaining patients. A real good hint that was given to me by one of our more experienced firefighters is to go ahead and tag all breathing unconscious patients immediate.
The feature I like best about the START system is that it allows me to delegate the triage portion to my crew. This gives me time at the beginning of the call to examine the scene, determine any extrication problems I have, any additional resources I'm going to need, and in general get the incident command system rolling along. The START system really works well for me.
As a paramedic, I can come on scene and identify those patients tagged immediate. This allows me to begin treatment and transport in a timely and an efficient manner. The START system really helps keep it organized.
START triage is so fast. As an incident commander, when I arrive on scene, that triage function is already happening. Information I get from triage then helps me order additional equipment. As those units come in, I assign them to treatment and transportation.
I'm a fire captain and an EMT instructor. The beauty of START is that it's both easy and simple to learn. With a little review, you can maintain your competency over many, many years.